Hi, and welcome to another video from the CTAD Clinic. My name is Dr. Mike Lloyd and I'm the Clinic Director. Today we're going to be doing a brief discussion really about the use of language in some of our videos. We've obviously been discussing autism, trauma and dissociation in a number of the videos that we've been putting out. And some people have contacted us and said that they're not entirely comfortable with the use of the way that we're referring to autism within the context of our videos. And this is great because we have to encourage debate and we have to talk about these kind of things. And what's been happening is that we've been tending to use the phrase person with autism or people with autism. This is known as person first language, and this is more or less a sort of a clinical or professional or lay standard terminology for the way that folks like us, the clinicians and professionals, discuss conditions. So things that are listed in, say, the DSM or the ICD, or these are sort of our clinical conditions, and this is what we're doing our work with. So we tend to use that. So when we're talking about, say, diabetes, we say a person with diabetes rather than a diabetic person, a person with autism rather than an autistic person. So we tend to veer on the side of seeing the person in their own right and then the condition with which we're working with as a sort of secondary feature. That's the clinical standard, and that's been in place for many, many years and is up for debate as to whether that's correct or not. The alternative is this thing called identity first language, which places the condition or the thing that is being discussed, say autism in this context, in front of the person so that it becomes a part of the key feature of a person's identity. So identity first language would be an autistic person. We wouldn't use that for conditions such as diabetes. So referring to someone as a diabetic person seems to kind of limit what they are in terms of their diabetes. But with an autistic person, a lot of information, a lot of debate has gone on to say that actually this is the preferred way that people who have autism as part of their makeup much prefer to be referred to as. Therefore, it would be an autistic person, identity first language, rather than a person with autism as person first language. And the identity first language really frames what we're talking about as a key part of the identity of that person rather than this sort of add-on or this condition which has been picked up as they've gone along. And I think it's much more relevant with autism than a lot of other conditions as such, because autism is something that the person is born with, it's part of their life, it will always be part of their life, it's not a condition to be cured, it's something with which the person just comes to terms with and lives their life throughout, and is often quite misunderstood, and therefore seeing it as this like clinical condition or sort of disease process or something like that can be very damaging to people. And that's why when surveys have been done, for example, through the British Psychological Society in the UK, did a big survey with the National Autistic Society on this, there was this sort of like completely, divergent opinions on these things. So professionals and lay people tended to go down to the person first language, to be polite, to be thoughtful, to be respectful. And autistic people were saying, well, actually, great, fine, you do that, but we would much prefer to be using identity first language. We refer to ourselves as autistic people, not as people with autism. And that's fair enough. So we have to understand that this isn't a one size fits all thing. And, there are lots and lots of documents and lots of things out there. For example, the American Psychological Association did an inclusive use of language document. And that talks about all the different ways in which we can sort of use language and have alternative sort of preferences for the things that are being used. So let's say instead of a blind person, you might have a person with blindness, but that doesn't make sense. So blind person is the preferred thing. But then say, a disabled person, that's not great. So a person with a disability, that's much better. So it's a real difficult thing to get completely correct. And actually in that document, the American Psychological Association used the term person with autism. So they stick with the person first language, even in their inclusive use of language document. Fair enough, that's how they're doing it. What I liked about the British Psychological, the BPS document on this topic was that they felt that actually, being thoughtful, being respectful and having practical wisdom and applying these terms as it seems correct in the context of what you're actually doing. Now, if we were doing, let's say, a clinical conference to a group of professionals about autism, everyone's going to start talking about people with autism. If I'm having a conversation or doing a training event to, let's say, an autism foundation, everyone's going to want me to use the term autistic people. So we have to be very mindful of what the audience is that we're looking for and how we reference them in a way that doesn't make them feel marginalized or dismissed or not considered in any way. And within this channel, what I'm really keen to do is inform people about the links and the associations between autism, trauma, and dissociation. So primarily my goal in all the work we're doing with this channel, with autism, with dissociation, with trauma, is to demonstrate how these things can be linked together to help inform and educate people that are watching these videos. Now, sometimes those are therapists and clinicians, and sometimes it's the people that I'm targeting this at, the folks with these, with these conditions, with these things going on. So therefore, if my primary audience is autistic people for these kind of videos, it's going to be really important for me to change the language. And I really appreciate the feedback on this, because that's exactly what I'm going to do. We're going to start using identity first language when we're discussing autism in these videos, because what we're trying to do is get to people who are experiencing trauma and dissociation who are also autistic. Obviously, there's loads who are not autistic, and that's absolutely fine. But when we're bringing autism into the conversation, it's vital that we get this right, because I do not want to lose the audience. I do not want to have the message that we're trying to portray missed because we're using the wrong terminology in the language of our videos. I also hope realistically that everyone watching these things knows that our intention is to inform and educate and trying to give the best of our clinical experience and knowledge as possible out on these videos. We're not trying to offend anybody, we're not trying to do anybody harm, and we absolutely do not believe that anybody should be dismissed as a result of something that they are or something that they have picked up along the way. So we are entirely comfortable swapping over and moving to autistic people who dissociate or who have dissociation, autistic people who have been traumatized, rather than people with autism who have been traumatized and who dissociate. It's totally fine for us to do that, and that's what we're going to do. So again, brilliant feedback. So thank you for the people that have discussed this. I hope I've done the topic justice. It's a really big, important area. We're never going to get it right. I will always defer to what a person prefers, however. So within our clinic, there are folks who would prefer to have the terminology person with autism when I'm talking to them, and there are those who are happy to be called autistic people. So I will mix and match that within the clinical setting on an individual basis. But for the challenge of producing this information through the YouTube channel, I think it's entirely correct that we swap over to identity first language, and that's what we're going to do. If people are not happy with that, I'm really sorry. I hope that the intention of what we're trying to do is the key thing here, and that people understand exactly where we're coming from, that we're absolutely here to inform and educate and not to dismiss or marginalize anyone in any way, shape or form. So I hope that's been useful. I really look forward to the comments on this. It would be great to see where this debate goes and to see whether people agree or disagree. So please leave your thoughts in the comments at the end of the video, as always, and I'll read them and reply to as many as I have time for. So we'll obviously continue doing all the other work that we're doing and produce more videos. So please like, subscribe, share, do all the usual stuff, and we'll keep making this content for you. So between now and the next video, please do take great care.